Hello, everybody. What I'd like to do over the next couple minutes is to go over two topics that are going to be happening in all of our pharmacies over the next couple months. The first one, I'm going to be talking about a new regulation um, that affects how we handle certain drugs, and that'll be USP 800. And the second thing I'm going to be talking about is the implementation of Pioneer workflow that's going to be occurring in every store. Explain, kind of give a large overview of why we're doing it, and to share with you what the ultimate goal is, especially over this coming year and the following year. USP Chapter 800 comes from the federal organization United States Pharmacopoeia. This federal organization's mission is to improve global health through public standards and designed to help ensure quality, safety for the benefits of medicine and food. There are numerous chapters under the USP stating different regulations about medications and food. A lot of these regulations apply especially to hospitals and compounding pharmacies. However, this current new ruling USP Chapter 800 does have an impact on how we handle certain medications within the community pharmacy. And what USP Chapter 800 does is it requires healthcare entities like a community pharmacy to handle hazardous drugs and use standards to help to use occupational safety. It's no different than how we have standards of how we have to handle, needles when we give an immunization. And so we're going to be talking about what those standards are and how they're going to impact our pharmacy. Over the next couple weeks, you're going to be hearing from me. We're going to be posting regulations. We're going to be doing some on-site training with everybody. And this is designed so that we protect ourselves from hazardous drugs. Now, these medications are medications we've been dealing with for multiple years. And the exposure that we are exposed to these drugs in their intact capsule tablet form is a very low minimum. And this risk, some question how high of a risk these are, especially in the community setting. The settings where you're doing a lot of physical compounding, doing a lot of manipulation of, using IV medications, those are where the greater risk is. Nevertheless, hazardous drugs, what they are is any drug or active pharmaceutical ingredient that is identified by the National Institute for Occupational Safety and Health, which is called NIOSH. And this list lists anti-neoplastic drugs, which are drugs used to treat cancer, and other hazardous drugs in the healthcare setting. You may have noticed lately in the Pioneer system, and you'll notice this even more when workflow is turned on, that it will actually flag and tell you if a drug is hazardous. And the drug is hazardous either 6 of these criteria. That is carcinogenic, where it has the potential to, cause cancer, teratogenic, or developmental toxicity for somebody that is of childbearing years, whether or not this could be passed on to the fetus to cause birth defects. It may have effects on people who are trying to become pregnant, reproductive toxicity, organ toxicity, may affect our genetic composition, and any new drug that may mimic existing hazardous drugs in structure or toxicity. So when newer drugs are coming out like generics or biosimilars. But the drug would fall into one of these categories. And the NIOSH list has 3 groups. The first group are the cancer type of drugs, the anti-neoplastic. The second group are the non-anti-neoplastics. And the third group are the reproductive risk. The drugs on the NIOSH list have to follow the Chapter 800 requirements. And what the Chapter 800 requirements say that if we are in handling of any of these active hazardous drugs, or we are doing any manipulation to these hazardous drugs, that we have to follow certain requirements to protect ourselves to minimize any risk. And but what it does say that the final dosage forms of compound hazardous preparations and conveniently manufactured hazardous drug products that do not require any further manipulation other than counting or repackaging, they may be at lower risk. And so one of the things you may have noticed lately or over the last especially year or two is that when we get orders, especially from Value Drug, any of the hazardous drugs come in a red plastic bag container. This is just a brief listing of what some of those drugs are. The one thing nice about Pioneer is we can actually run a report to identify what those drugs are and how we're going to identify those. And I'll talk about that in just a second. So what do we do or required to do? Well, we're required to have a policy and procedure of how we're going to be handling and identifying hazardous products. This policy and procedure we will be posting by the beginning of next month. How we are going to handle this, you'll find this on our internet. The first thing we have to do is identify hazardous drugs. What has come up with a lot of the different experts we've been talking to and working with our wholesaler Value Drug is that what we're going to be doing is when those hazardous drugs come in, we are going to be purchasing orange rubber bands. I feel that in talking to others that dots is probably not a good system just because dots can fall off and we're repeatedly getting new product in. So what we'll be doing is we'll be putting an orange rubber band around these products. And that is the biggest one. It is not required that you have to have them in a separate section. I'll be talking with the managers. If you feel that the separate section is better and space is warranted for it, we can go ahead and do that for that. But the minimum we're going to be doing is identifying them by having an orange rubber band. So then when you see the orange rubber band, you know that there has to be certain cautionary things to be taking. The Pioneer system, as I said, can identify these hazardous drugs too at the point of dispensing, especially when we turn workflow on at your pharmacy. The other thing is we can no longer have any of these products in ScriptPro or the RX Safe, and so those will have to be removed. And the main reason why is if those tablets would break or they would get out of the bottle in the RX Safe, what would we have to do to potentially prevent any decontamination? Because the biggest thing with these hazardous drugs is if there's a lot of dust created by the manipulation of these products, that is where our risk might be occurring. And so we also will have a policy and procedure, and Value has actually kind of posted this already on their hub and in their Value Views of how we will be returning those to the wholesaler, and we'll be using the same companies that we use to dispose of other hazardous waste in large sums. But for example, if a bottle is completely empty and there's just barely any powder in it, that can be disposed of just regularly. However, if we have a bottle of expired drug that has numerous tablets in it, and the wholesaler is not going to take it, we have to follow the policy procedures of returning it, of getting rid of it through our hazardous waste company. So what we do need to do if we are going to be either counting, cutting, or crushing tablets of the formulations of these hazardous drugs is that different drugs are going to have different requirements. The basic requirement is we should have a designated separate counting tray for these drugs. For our icons, we'll have a special tray for hazardous drugs, and then after those hazardous drugs are counted, we'll wipe those down with alcohol. Making sure that nobody is touching those tablets physically. If you have to, you'll be wearing gloves. And depending upon the assessment of risk of the drug, we will either, especially if we are cutting tablets, and there's never really a time we're crushing tablets unless we got into any special compounds. So I'll be just sending out a request to over the next week of asking anybody, and I'll be looking in our system if we've done any special compounds or we're doing any special cutting. If those drugs that do fall into hazardous drugs that are required cutting, it is considered a minimum risk for those drugs. The only drugs that we would not probably cut at all are hazardous 1 class drugs, the anti-neoplastics. But those who are 2 or 3, what we're required to do is pretty much be wearing, in talking with experts in this matter, is we will have to glove and also wear a carbon filtered respiratory mask to minimize any risk, and then also, wiping down the surface of where we did do the cutting of the tablets. So in summary, what our actions are going to be occurring when you get our policy and procedures is we're going to be creating a list of hazardous drug dosage forms, where they're located, check each hazardous drug for risk exposure, spill cleanup, storage, handling, transport, administration, and disposal. Identify hazardous drugs that qualify for risk assessment, and I'll be putting those into the policy and procedure too. And we'll also develop a plan of action how to minimize and manage the risk of each drug. We do not have a lot of products running the list. We have a lot of products have multiple strengths, but we do not have a lot of products, so this is not going to have a super major impact, but we have to follow this regulation. Currently, right now, the State Board of Pharmacy in their last meeting in October ruled that they're going to delay enforcement of this, so we do have time to get this implemented. We've been delaying of implementation of this due to the fact that there had been several of the other chapters that impact hazardous drugs that they were actually put on delay, postponed. Currently, right now, USP 800 is not on delay, but the State Board of Pharmacy is not going to do enforcement of it. But the Board of Pharmacy does say that pharmacy should have a policy and procedure in place over the next couple months. All right, let's go to the next topic. The implementation of workflow in the community pharmacy. When we went with Pioneer several months ago, Pioneer had the ability to turn on what is called workflow. Most chains in the country use some type of workflow, and any successful pharmacy wanting to implement other enhanced pharmacy services are successful if they have a quality workflow. When you look at just the plain definition of workflow, we've been doing some type of workflow for multiple years. Basically, workflow is a sequence of either physical or mental tasks that we perform to be able to distribute a safe prescription product to our patients. And think about, there's numerous things we do in getting that drug to our patients. There is the input collection phase that we do to be able to get the prescription. There is the through processing phase, whether it's through counting or using any of our robotic systems or special packaging. And then there's the output phase of getting it to the patient and being able to talk to the patient and counsel them about their medications. Our input is several things. We do internet refills. I take that back. We do not do internet refills, but we are slowly going to be doing that over the next couple months. We're looking into RX Local app that is part of Pioneer. But what we do right now is we do e-prescribing, and we have our IVR system is how we get that in. The throughput process is how we process our claims through the internet, how we use robotics, whether it's as simple as the icon or a script pro, to do a verification. And the most important part of the Pioneer workflow that we're implementing is we're going to be doing a lot of barcode scanning in the filling process. And this barcode scanning is going to make sure that we're verifying that we're filling the right product to minimize med errors. And then we have our output phase of one thing the workflow will do. It will allow us to track where the prescription is better. We'll no longer have to do that extra step of scanning into the bins. There are some of us at different of our pharmacies that we do have special bins that we do scan, but when the pharmacist is in the check phase of the pharmacy workflow, that will automatically go into the bin. The other goal of pharmacy workflow is it's going to help enhance our clinical community workflow. And what do I mean by that? Well, one of the things that for us to be able to free up time, and we've been focusing on this over the last couple of months, especially trying to grow our MedSync program, is that for us to free up time, we need to become more efficient and maximize our resources. And the purpose of workflow is to eliminate waste and inefficiencies. A lot of our pharmacies are going to change. Our roles and responsibilities might be. One of the things as I bring on each pharmacy for workflow, it is a process. It's not just a boom, once we turn it on, that's what we're there. But the purpose of workflow is everybody is going to have different roles and responsibilities, but everybody's going to have to learn to multitask, because workflow is, there's a physical process of it, but there's also a mental process of it. So we will have our traditional order entry, and order entry will occur, where we're data inputting. There will then be what will occur in workflow to be efficient, that labels will only print if the patient is a waiter. If the patient is not a waiter, those labels will go into a print queue. And that print queue is where the technician fill clerk or the order entry technician or the pharmacist, whoever is assisting in the filling process when need be, they will be then triaging in that print queue who is the next person waiting, or is this a sync patient that we'll do later in the day. The ultimate goal of what the print queue is to organize our time more efficiently of getting things filled and not having multiple baskets, piling up, on the counter. The other thing is, in our workflow, we will be doing a lot of barcode scanning now through scanners, our Icon, our robotics, to make sure that what we're filling is appropriate and correct, so that when the pharmacist does check it, they have a good verification that what has been filled is correct. One of the ultimate goals of the implementation of workflow over the next couple months is that it needs to be able to free up our time to do other opportunities to take care of our patients. And those opportunities we're already doing a little bit of. The biggest opportunity we have been doing is immunization. But our goal for 2020 is to go beyond just flu vaccines. We are going to look to see how we can become better at being a leader in preventive health, of identifying patients who may need pneumonia shots, who may need Tdap, who may need the Shingrix, and we are in the process of talking with GSK to increase our volume for Shingrix. The other opportunities that we're going to be focusing on is how the pharmacist can perform medication therapy management services as part of the workflow. We're going to be exploring over the next couple of years of getting involved into point-of-care testing, where we may be actually able to physically help patients assess whether or not they have strep throat, have influenza, doing other type of lab type of testings. This one is probably in the far off future, pharmacogenomics, but this is an area where pharmacy is getting involved. And then the final one is chronic care management. So as I said, the best way to free up our time with Pioneer Workflow software is using the technology to help drive change in the pharmacy. We are going to, our goal is I'm going to have you rewatch the workflow video in Pioneer University. And for those of the field clerks who may not have had opportunity to use the computer a lot, I am going to also be assigning you not just the workflow video, but the RX profile video, so you have more familiarity of going around that. But the ultimate goal of workflow is for us to be able to know where things are, to be able to prioritize our workflow day so that we can be able to eventually do those enhanced pharmacy services. We are joining a national initiative across the country, which is called Flip the Pharmacy. And the ultimate goal of Flip the Pharmacy, it's a 2-year process. And this process is going to allow us to go beyond just filling prescriptions at a moment of time, but to be caring for our patients over time. And this all is predicated on good med synchronization program and good workflow program. So many of the things that are going to be occurring over the next couple months to year is very predicated on us implementing workflow. So, like I said, I'm not going to take time. I've already taken up enough time in the meeting. I'm not going to take time going over the all the little small steps of what is involved in workflow, but I'll be reaching out to you to watch the Pioneer University videos and to be talking about how over time we're going to be implementing some of these different changes that the pharmacist and the technicians in the pharmacy will be part of to able to improve patient care and to grow our business by hopefully being reimbursed for other services that are not related to the distribution of the product. Thank you for your time, and I'm sorry that I could not be here today to deliver this material to you, but I'll be reaching out to you over the next couple weeks in both of these categories. Thank you very much.